Your Excellencies, delegates of the 69th session of the United Nations General Assembly, distinguished guests, ladies and gentlemen. On behalf of the Pan American Health Organization, the Regional Office of the Americas for the World Health Organization, it gives me great pleasure to welcome you to this side event, Women and Cancer, a joint commitment to save lives. I wish to sincerely thank the American Cancer Society and the governments of Belize, Brazil, Honduras, Jamaica, and Peru for joining me in this side event on empowering women to improve cancer care in Latin America and the Caribbean. Women's cancers have a devastating personal, social, and economic impact on families and societies. Cervical and breast cancer, which affect women in the prime of their lives, are responsible for a staggering 490,000 new cases and 128,000 deaths each year in the Americas. It has been noted that cancer outcomes are poorer among disadvantaged populations, even in high-income countries where there may be unequal access to health services. Furthermore, social determinants such as poverty, low levels of education, and ethnicity contribute to a disproportionate burden of cancer on vulnerable women. The challenge to address these inequities is rooted in our commitment to the attainment of the highest standard of health possible. The toll from cancer of the cervix is especially tragic because it is almost completely preventable. We know that many of these women's lives can be saved with greater awareness, HPV vaccination, and stronger health systems that offer quality cancer services for screening, diagnosis, treatment, and palliative care. This must be accompanied by seamless care across primary, secondary, and tertiary levels of the health system. PAHO strongly believes that universal health coverage can provide the necessary conditions to improve cancer prevention and control. Universal health coverage can give people equitable access to the comprehensive and quality services that they need throughout their life course without financial hardship. Yet, it will require policy changes in healthcare organization, financing, governance, and service delivery. No woman should become impoverished as a result of a cancer diagnosis. To combat such an enormous public health problem, we urgently need all sectors of society to work together to improve cancer prevention and care. For this reason, PAHO has created a multi-sector women's cancer initiative in which we are working with our member states and in partnership with the American Cancer Society, the Network of Cancer Institutes of South America, among others. But we need to expand our partnerships. We need to create synergies and extend the reach of our technical cooperation. It is against this background that PAHO as an organization and I personally seek your support to jointly accelerate cervical and breast cancer prevention and control. We need your support to help our countries in 5 main areas: to advocate for women's cancers to be high on the public health agenda in your country, to educate, inform, and empower women to seek early preventive health care, to assure that services are available, affordable, and accessible for screening, diagnosis, treatment, and palliative care, to help make HPV vaccines more widely available, and to engage in partnerships with all constituencies active in the field of women's health in order to support and fund the areas I have just mentioned. We have set ambitious targets for cervical and breast cancer in the PAHO Regional Plan of Action on Non-Communicable Diseases. And there are already some remarkable examples on the public health advances. Some 20 countries in the Americas have introduced HPV vaccines and are protecting girls from cervical cancer. About 5 countries have begun to implement HPV testing in their screening programs as a more effective approach. But we have much more work to do, particularly for the early detection of breast cancer. In this session, you will hear more about the commitments of government and civil society for women's cancers. It is my fervent hope that this event will inspire you to become more active in the fight against women's cancers. I believe that collectively, we have the power to change the story. Thank you.